or anything, so nothing is happening officially
Yeah. Okay.
right
Sure.
now.
Sounds good. Yeah.
So it just takes a minute to get over there.
It says it's being live streamed right now, I believe.
Yep. Well, hey there, Shoshana. Thank you so much for joining me today for the Confident Sober Women podcast. I'm so excited to dig in to your content. I know this is a little non-traditional, everybody, so just kind of hang in there and enjoy the ride. I have no idea where we're going to go, but I do know it's going to be really interesting. So I'm going to kind of kick the mic over to you and let you share a little bit more about kind of your story with this particular topic of addictions, treatment, and how things are done in our country, and what you've discovered. And then we're
Sure.
going to chat
Yeah.
about it.
Yeah. Well, thanks so much for having me. My name's Shoshana Walter. I'm the author of a recently released book called Rehab: An American Scandal. I'm also a longtime investigative reporter, mainly focused on the criminal justice and child welfare systems. I'm currently an investigative reporter at the Marshall Project.
Mm.
And my book is basically a narrative nonfiction expose of our addiction treatment system and the ways that it changed over the course of the opioid epidemic, expanded, became more accessible to a lot of people, and also the ways that it's not meeting the needs of people who are mired in addiction in the United States. There's a lot of ways that our treatment system is not providing the opportunity that a lot of people really need in order to enter and sustain long-term recovery. So my book really focuses on those different aspects. I cover the lives of four different people, each interacting with different aspects of the system. Two people struggling with opioid addiction who went through the treatment system and came out the other side. An addiction medicine doctor who tried to offer treatment to patients and then ended up getting arrested and raided by the DEA, and also a treatment advocate, a grandmother from Los Angeles who decided to root out corruption in the for profit treatment industry after her own son died of an overdose years ago. And that really focuses on the lack of regulation for treatment programs in the United States. So there's definitely a lot of different aspects that I cover in this book. Um, and as for me, I don't have a personal experience with addiction. Of course, like any person in the United States, I have family and friends who have struggled with addiction. But I basically came to this through my many years of covering the criminal justice system. About 8 years ago, I was an investigative reporter at Reveal from the Center for Investigative Reporting, and working on some stories related to drug courts and diversion courts, and just stumbled across this treatment program in Oklahoma and Arkansas, that was sending people to work at for profit chicken processing plants. And when I started doing a little bit of digging with my reporting partner on this story, I learned that it had been founded by a former poultry industry executive,
Mm.
and that people getting sent there for rehab were instead working without pay, making chicken products for KFC and Popeyes and Walmart and PetSmart and Rachel
Oh
Ray
my goodness.
Nutrish. And they weren't getting paid anything. The jobs were dangerous, frequently leading to injury. And if someone was injured and didn't get adequate medical care, they were often sent back to the court that they came from,
Mm.
where they ended up, getting violated and sent to prison and jail oftentimes. So this is my first foray into addiction treatment. I had kind of just assumed that our treatment system was there to help people. And I realized that it's actually very easy in this country to exploit this population of patients for profit. And so that story really made me want to understand how common that is. And if indentured servitude could be considered addiction treatment in this day and age, then what does the rest of our treatment landscape looking like, and is it really helping people the way that it should?
Mm. Thank you so much for sharing that, how you kind of got here. I think that's really important for us to all understand. And like I mentioned already to all of our listeners, this is a little non-traditional, but I do think it's obviously heavy hitting in our population. And it's actually something myself as a mental health provider, I've been in recovery for a couple decades now. And, I've been around the bend. I'm not heavily involved with the treatment facility aspect of, although I do have relationships with some of our local providers. So I don't have a lot of understanding about what you've done. However, I do think in the last couple years there's been some rumblings, and probably much like you, people are starting to uncover. I can't remember where first heard about this. It was maybe at a conference or on a podcast with somebody else who was kind of uncovering not the indentured servant part, but just some of the other issues related to our addiction treatment, like inpatient treatment facilities. And that was the first time I had really heard about it. And so and I'm in the industry, I know that most people probably are really not aware. And as somebody who also does promote these types of facilities to my clients, to people in the community, not without some vetting, I would have to say, but
Hmm.
it is a concern. So I'm really curious to dig in a little bit more. And one thing, other question I had is the other thing that kind of came up a lot, maybe in the last 4 or 5 years, maybe more, maybe to me, is kind of the wilderness programs. And I think that's probably just from the birth of TikTok and social media, people being out about things. And so I'm wondering if
Yeah.
this is a very similar kind of concept to that, if it's related.
Yeah, I mean, the wilderness programs, you're probably thinking of like troubled teen programs, and I think Paris Hilton has really done
Mhm.
quite an amazing job getting that conversation out there and in the public consciousness.
Mhm.
And I didn't do a lot of reporting on wilderness programs, but I think that these troubled teen programs actually have their origins in a program that I do detail the history of in my book, called Synanon. I don't know if you're familiar with the story of Synanon. Um, it's kind of like the precursor program to rehab of today in the US.
Mhm.
It was founded in 1958 by a former oil salesman named Chuck Diedrich, who had struggled with alcoholism. And had tried AA and he hated it. He hated the 12-step program, the 12-step groups. He felt like people could go into those meetings and lie about their sobriety, have relapses, slip ups, and no one would ever know. And he wanted a group, a community where people could confront each other and call each other out, kind of like a tough love kind of approach. And so he started this small little community on the beach in Santa Monica and ended up growing nationwide. A ton of programs split off from it. Copycat programs proliferated. And there were a lot of practices in Synanon that were replicated by troubled teen programs and a lot of other rehabs in the United States still to this present day. And those include
Mhm.
groups called The Game, where people would take turns screaming at each other and kind of calling out each other's flaws and slip ups and problem behaviors.
Mhm.
There's lots of practices that are still utilized today, like pull ups, where people
Wow.
have to essentially tattletale on each other a certain number of times each week. Um, and the way Synanon operated was mostly without any government funding. The program funded itself by having participants work, and all of their work, the compensation that they would have received from their work, went back into the program. Um, it has a very lengthy history and kind of a sordid ending because eventually Synanon morphed from this recovery community where people came and kind of transformed themselves into a cult like group where the founder enriched himself, kind of operated like it was his own fiefdom, um,
Mm,
started ordering people to shave their heads,
mm,
ordering vasectomies,
mm,
separating children from their parents, um, all these rules. He created a mercenary army that attempted assassinations of critics, including a civil rights attorney who had been
mm,
suing the program on behalf of people who had been abused in it. Two of the members of this mercenary group hid a rattlesnake in this lawyer's mailbox and it bit him, and he
mm.
ended up surviving that attack but dying of complications just a few years ago. And eventually this nonprofit, what started out as a nonprofit recovery group, community, ended up getting shut down by the IRS, um, over various issues, and it is no more. But a lot of those practices continue, including the unpaid labor,
Mm.
um, a lot of these behavioral modification techniques, and it's very much still with us in the form of these troubled teen programs and a lot of other rehab programs, including one of the rehab programs that I cover in my book called the Senecor Foundation.
Wow. Um, what I was thinking while you were talking, and maybe correct me if I'm wrong, and I'm sure from your point of view now, it might be difficult to even see this, but I kind of was feeling like, this is a great example or an example of how something can be starting out for good.
Mm,
For good. Like, right, this man was having his own struggle. He was dealing with alcoholism. He wanted to serve. He obviously must have gone through some 12-step work. He got sober. He managed to put together time, and then he wanted to serve others who had the same problem. So his mission was good, right?
yeah. Yes. I mean, I would think so. I mean,
Yeah.
you never know what someone's true intentions might be, but I mean, I think it sounds like a very worthy interest and intent.
Yeah.
Yeah,
And
to
then I guess
create
it's just hard
community
to
for
see,
people.
like, yeah, and I know this is another topic, and I don't really necessarily want us to go down this path, but like we start out that good, and then he's trying to come up with things that he think will work, and it starts out in a positive way, right? And then something happens, and I feel like this is just the bane of the existence of many organizations, right? Something happens. There's like a switch that flips, whether it's greed or power, or I'm not even sure what, that starts to send somebody down another path. And wow, that is so disturbing because again, like what started out as something good and a mission that was probably very positive and powerful and helpful to others got down into this horrific kind of way that ended up becoming very harmful. So it's just so sad how that can happen and relatively quickly. So I'm kind of
Yeah.
curious, like when we were talking in the beginning, and I'd love for you to share a little bit more about how you kind of got here. Like, how did your earlier work lead you to this? You mentioned criminal justice, child welfare, drug courts. So tell me some of the specific things that really got your mind going and wanting to like explore this.
Yeah, I mean, well, just learning that unpaid labor for for-profit companies could be considered treatment by
Mm,
court officials and prosecutors and people who you would think would know better, just made me want to understand what is going on. I mean, really, over the course of the opioid epidemic, I feel like our country has really undergone this shift. A lot more people have come together around this notion of addiction as a disease that's
mhm.
worthy of compassion and medical care and treatment. And so I had just assumed that that was how um, treatment programs would approach recovery and addiction treatment. And so I was just totally flummoxed and thrown by discovering this program. And when I was at Reveal, we continued that reporting and ended up finding similar programs all across the United States
Wow.
operating very similarly. Um, there was a program sending people to work at nursing homes and at the zoo, at Williams Sonoma and Walmart warehouses. And then we ended up doing this podcast series at Reveal called American Rehab, multi part series where we really dove deep into the origins of this model and how widespread it is. And we ultimately found that at least 60,000 people, which is a massive undercount, go through this type of program every year in the US. And, I just, and the reason why people are going into these programs is because they are meeting an unfilled need. You know, these programs tend to be longer term.
Mhm.
People live there, they work there, they have food there. So these programs offer what you might think of as long-term stability, and that is something that a lot of treatment programs are not necessarily providing right now,
Mhm.
especially insurance-funded programs. They tend to be shorter term. So these programs were filling a need among people who lack insurance coverage or lack the stability in their lives
Mhm.
to reliably have a place to call home or a roof over their head or food to eat. And I think a lot of courts are relying on these programs because they don't cost the government any money. They're basically self-funded through this uncompensated labor. What I found again and again is that these programs were often taking that to an extreme. And it's not necessarily legal under, U.S. labor laws.
Yeah.
Um, but, courts could send people to these programs and not have to worry about spending money to provide treatment to them.
Mhm.
So I think that's how we've gotten to this place with these types of programs. Um, and in the book, while working on this podcast, I met a young man in Louisiana named Chris Kuhn. And he had gone to a program in Baton Rouge who that sent him to work at unpaid jobs up to 80 hours per week. His compensation was a pack of cigarettes per week.
Mhm.
And he had a traumatic experience. And when I first met him, he had recently left that facility. He was still um, going through this emotional experience from recovering from that. Um, but he really wanted this story told. And so he allowed us to meet him outside the welding school where he was attending at the time. And he came out on his lunch break with a Diet Dr. Pepper from the vending machine and got into the backseat of the car. And we talked for a half hour. And then over time, I got to know him really well. I met his family. I interviewed his parents, who had tried very desperately to get him better for many years,
Mhm.
and told his story. His story, is in the book, and you know, uh, it's not just a story about this treatment program that was mistreating him and so many others that went through it, but it's a story about what it takes to really recover in the United States. And
Yeah.
I think that was one goal with my book, Rehab an American Scandal, was to show what our treatment system is missing and how people are able to gain recovery.
So, wow, I have so many questions, but I really want to stay on track because we
I
have
know, I
I do have a lot of
apologize for
questions.
throwing a lot
I
at
do,
you.
yeah, I do have so many things to ask. So, when you, just that last part that you said, so when you, um, did do this research, because what's going through my mind too is so I'm hearing what you're saying. I'm hearing what you're saying about these are kind of specific privately funded programs that don't take insurance. And so it's appealing for the court system. It's appealing to the patient or the client because they're long term, which long term recovery, long term treatment in our country is not available. It's
Right.
inaccessible and it doesn't exist. It's very, very sad. It's a huge
Yes.
gap. And so that's appealing because you're like, oh, suddenly, parents, people would be like, wow, this is what you need, 6 to 12 months of like immersion, right? But
Correct.
and I don't want to get too down this track because, and I'm not an attorney. I don't know, but like the legality part of it you mentioned, because that's how you're talking. I'm thinking, okay, well, how did they work around this? Because, if they're basically working to maybe pay for their treatment, right? They're working to pay for their housing, their food. And so they are being compensated. Let's not like minimize that. It's just that it's not in a traditional way, right?
Yeah, I mean, what I learned from reading all the case law, from interviewing Department of Labor officials from over the years and looking at previous Labor Department investigations, is that housing, food, that could be considered compensation, but any money made beyond that belongs to the patient.
Okay.
And so, what I saw with the program that Chris attended, I was able to get internal financial records from the company, from sources within the company, I should say. And what I could see from those numbers is that these patients were working far more than they
Okay.
needed to and actually in order to actually cover the cost of their stay. I mean, Chris was working up to 80 hours per week,
Mm-hmm.
making thousands of dollars that all went back to this treatment facility.
Mm-hmm.
And when he entered the program, this is where it's I have such sympathy for parents and people looking for treatment, because when he entered the program, he was told, you'd live and work here for 2 years. You'd be able to save money for after you leave the program, which
Mm-hmm.
sounds absolutely wonderful because that is so often what people are lacking when they're new to recovery.
Mm-hmm.
But he was not able to save. He was there for 18 months. He was None of the money went to him. It
Okay.
all went back to the treatment program. And, he was supposed to receive counseling, medical care. You know, he rarely received counseling. I spoke with this counselor and many other counselors in this program. They were so overworked. It, you know, she told me that she would stick her head into his bedroom at the end of a long day of work, ask him how he was doing. He'd say fine, and then she'd mark that off as a counseling session.
Oh,
So
okay.
this was an ongoing issue with this program for years
Mm.
that, regulators had even received complaints about, and yet the practices continued.
Right.
Although, after our podcast series came out, American Rehab, Senecor did decide to end their work program.
Okay.
So,
So that's not
um,
so the program philosophy and structure even isn't the problem. Like that's okay. That's like a legal way to provide long-term care for people, but it was the overworking, the taking of the money that was beyond above and beyond their care to fund, I guess, the executives or whoever, and then not following through, obviously, with promised things like saving the money and things like that. So, is that correct?
yeah, it
Okay.
can be considered legal for patients to work in a program and receive compensation in the form of housing or food, but it needs to be done with their consent,
Hmm.
and it can only be the actual amount of those services. It's a little
Okay.
bit like someone performing labor on a farm or ranch and receiving housing in a trailer. That's a form of
Hmm.
that's a piece of their compensation, but it's not all of it. And that's at least what I learned from reading all of the case law, from speaking with
Hmm.
labor department officials. That is what is
Right.
legally allowed under the law.
And that makes total sense, and I think that's really helpful for people who are listening who might be in this situation, like literally right now, might be in like investigating themselves, like where can we send our loved one, and so when they're coming across things and like trying to vet them, right, try to be, and you're dealing with a very emotional situation, often people who have been through the ringer, it's not their first rodeo, so we want to make sure that we are clear that like if something comes up like that, it's not necessarily bad, but you do need to look into a little bit deeper. I mean, even when you were sharing, it's almost like that program AmeriCorps kind of came to my mind, or things like that, where you're not really you're working, you're doing stuff, but you definitely are not earning, a big living. You're getting a small stipend probably, and then most of your expenses are covered. So it's kind of
Yeah.
like that. Like that's how the legality of it can work. But this above and beyond and not getting the services that you were told you were going to get is definitely not okay. Um,
Yeah, I think that's something that people should keep in mind when they're vetting a program.
yeah.
How many hours are they working? If they're being compensated for their work, what form does that take? How does that money get to
Mhm.
them? What other services are they offering? And, I think the difficulty with Chris in this program is that it also relied on this Synanon model of behavioral modification. And really, part of that model entails breaking people down until until they completely surrender to build them back up. And I think for Chris and many other people that I talked to for this reporting, that had the effect of stripping away all of their self-worth.
Mhm. Mhm.
And then they were in a situation where they were being exploited and
Yeah.
utterly powerless. And so I think that it's really important that when people are vetting treatment programs, they understand that there are these risks involved,
Mhm.
and patients are very vulnerable to this
Yes.
kind of exploitation.
And frankly, I think this goes without saying too that this is for any kind of treatment facility that you're going to invest in. I mean, even there are mental health facilities that are just focused on mental health, inpatient facilities, and some of even those teen ones we were talking about different things that aren't substance abuse related. So any kind of investment you're making in treatment, you really do need to do your due diligence. You need to get referrals. You need to ask around, dig into it to make sure that you're getting what they say you're getting, and that the treatment is proper and humane and compassionate, like you mentioned. So, have you been able to? I mean, what has happened? To many, have they shut down as a result of your podcast and book, or what is happening with these things?
I would say these types of programs continue to exist because as I said before, they're filling this need for long-term care. Chris, I will say, he left Senecor. He was badly injured in the program and didn't receive
Mm,
adequate medical care. And he ended up leaving the program early. He had been court ordered there. He assumed he would be sentenced to prison. Instead, he got probation. And one aspect of the book that I cover is the racial disparities that exist in our criminal justice and treatment systems. And so, Chris luckily was sentenced to probation, and then he went home, and he came from a middle class family, who luckily was able to take him in. When Chris felt like he was starting to slip, they helped him pay for Suboxone, which at that time was hard for Chris to find,
mm,
and to get covered by insurance. And he started going to school. He started kind of getting his life back together, and he was successful. Chris has now been substance free for many years. He's living in Texas and is married,
mm.
with two stepchildren. Um,
That's
but
wonderful.
one of the Yeah, it's wonderful. I will say that one aspect of my book, that I think is really important for people who are looking to get into recovery, and really important for treatment practitioners, is this concept of recovery capital,
Mm,
which is the mixture of internal and external resources that people need in order to enter and sustain recovery.
mhm,
And that can include social support and community, but it also includes housing, transportation, financial security, food, um, uh, a job, all of these aspects of life, these basics that are actually very difficult for people to access when they're early on in their recovery or just trying to come out of their addiction. I mean, the longer that someone is in their addiction in the US, the more marginalized they become, the harder it is to access recovery capital. And what studies show is that the more recovery capital you have, the greater your chance of success at recovery. And so Chris had that recovery capital coming out of Senecor. He came out of Senecor and he didn't have nothing. He had some aspects of recovery
mhm.
capital that really aided him in the long-term recovery process. But
Yeah.
there's another person in my book, April Lee, who grew up in poverty. She's a black mom of three from Philadelphia who grew up with a mom who was addicted to crack cocaine. And what her story shows is that access to recovery capital in the United States is very unequal. And so when April was just starting her recovery journey, it was much more difficult for her to access that recovery capital and gain that stability that she needed in order to stay in long-term recovery.
That's so interesting. I like that term, recovery capital. Um, but some of the things you mentioned, I mean, things like family, um, resources like money, education,
Mm-hmm.
community, um, and then on and on and on, access to things. Yes, I mean, I feel like the disparities for sure in our society are just that they are there, in every, I think amongst just those things, there are disparities and very likely that will always be the case, right? Because there will always be some that have more, some that have less, some that, live that just don't have the same opportunities. And so, this is not unique to recovery, I guess is my point. This is
Mm-hmm.
just, you worked a lot with the justice system too. We see this, and it doesn't
Yeah.
mean that it's an excuse for anybody to commit crimes. Like when you break the law, like that there are consequences for that. However, sometimes people are in situations that are different because and make choices because they don't have that kind of capital, which we're aware of. And so it's kind of challenging because it's not like the country really can do a ton to like create recovery capital for somebody like April Lee, right? If she doesn't have a stable family environment, if she doesn't have people in her community that are healthy, that are supportive, that are mentally well, it's kind of like what are we to do, with
Mm.
that?
Yeah, well, I think that when I think about April Lee, when she was struggling with addiction, which started really with childhood trauma,
Of
um,
course, yes.
and it was exacerbated by sexual assault.
Hmm.
She had three kids. She was the sole caregiver for them, the sole financial support for them. And there was no place for her to go to get treatment.
Hmm.
This is one of the findings from my book that low income mothers have the hardest time still to this day accessing treatment
Hmm.
out of any group in the United States. And this is a problem we've known about for decades. About 70% of women struggling with addiction have children. We know that treatment programs that allow them to bring their children with them have better outcomes for the entire family.
Yes.
Um, During the crack cocaine epidemic, this was enough of a concern that lawmakers actually uh, issued guidelines to states to set aside a certain percentage of funds specifically for treatment for women.
Mm,
But over the course of the opioid epidemic, I found that the number of such programs that cater to mothers have actually drastically declined. There's now only about 3% of facilities nationwide that allow women to bring their children, and less than 5% that provide childcare. So when I think about recovery capital for a mother, a single mother like April, that includes childcare. That
mhm,
includes being able to attend treatment and care for her own mental health problems without having to abandon her children.
right.
And because these programs, which exist in the United States, there's some programs that in this country that are doing amazing work for mothers, but they're a very teeny slim minority. And so what is now happening in the United States is that mothers are being separated from their children, they're being incarcerated, or they're overdosing and dying. We've started to see overdose deaths tick down nationwide, but over the past few years, overdose deaths around among mothers have been skyrocketing.
Mhm.
So there are definitely things that are being done that could be done to provide people with more of a chance at recovery,
Mhm.
uh, and in a way that doesn't lead to lifelong trauma for both the mothers and their children who are taken out of their home.
Sure. Yeah, those are some really big system issues, some of which we talked a little bit about before we started the interview. And, it's that's way above my pay grade, right? But these are big system issues involving insurance companies, involving public policy, involving just access to, just funding for these kinds of organizations. And, that's what a great opportunity for us to be advocates for those things, in whatever way we can find ways to do that. I have some connections with organizations like Shatterproof. I love them. They're so great, and they're doing a lot of this sort of advocacy work and educational work for families and patients and communities and workplace. I have another friend I've interviewed here too. She's her whole business is basically creating work. I don't know how she describes it. Basically, she goes into companies to help educate them on addiction and how to talk to their employees about addiction and what resources we have as a company. Like, you work for my company, you have an addiction problem. Here's what we can offer you. So there are people that are spearheading in this way, and we have to just keep at it. We have to keep the messages flowing, right, about the disparities that we have in this country that can be addressed from a variety of resources, right? Some of it will be nonprofit, some of it will be the public sector, some of it will just be maybe your local community, your church environments, your family systems that are in your little town. So we have to kind of, I think, as communities, we can kind of band together to look for those opportunities, how we can be supportive, whether it's financially or just volunteering time or, resources,
Hmm.
things like that. That's a wonderful thing.
Yeah, yeah,
I'm curious if
yeah.
you do any work around any of the other facilities, like the ones that are more like 30-day or like the kind of typical ones that we know. When we hear rehab, I think we generally think that, the ones that I was
Hmm.
referring to earlier. Did you look at any of those? Because in my experience, personally and like professionally as well, that they're not doing any of those things. I'm not saying that they're perfect, for sure that there's definitely some room, for some improvement, but I'm curious what you found.
Yeah, I mean, what I found with 30-day programs especially is that oftentimes, and in particular, I looked in Southern California, which has become kind of like a
Mhm.
rehab capital of the United States. And what I found is that the programs are often so short term that and lack ongoing support. So once people leave, um, relapse is often very likely. And we actually know from studies now that someone who completes a 30-day treatment program is much more likely to overdose and die in the year following treatment than someone who fails to complete a 30-day treatment program. So I think that there is a real issue with insurance companies not providing funding for longer term support. And that unfortunately is putting a lot of people at risk.
Mhm.
Um, One of the people that I follow in my book, Wendy McIntyre, I mentioned her earlier. She's a grandmother from Los Angeles who became an advocate for better oversight of treatment. She there was one program in her own backyard in the mountains of San Bernardino that was over medicating patients to the point of impairment, and I found several patients who died in this program after receiving really strong cocktails of detox meds that were not appropriate for the substance issues that they were having, that records showed were not even prescribed to them by a doctor.
Mhm.
And what I found, what Wendy showed me through her investigations, is that these are the types of programs that really proliferated in the aftermath of the Affordable Care Act. And it's an amazing thing that people have far more access to treatment than they ever did before. But these types of programs also have totally overwhelmed regulators.
Mhm.
And today in Southern California, where the majority of treatment programs are located in the state, there's only 5 investigators tasked with responding to complaints.
Oh, wow.
It can take months, sometimes years, to resolve a
Wow.
complaint, even involving a death of a patient. So the
Wow.
oversight of these facilities, and I'm not saying that every 30-day treatment program is there are plenty of wonderful, well-intentioned programs, but the oversight of these facilities is just not there. and insurance companies are not covering the length of treatment that many people need in order to really benefit from that treatment. And so, I interviewed one treatment company owner who referred to it as a cycler. The the patient comes in, they stay for 30 days, they leave, they relapse, and then they come back in. And unfortunately, I think that has become part of the business model for treatment. This
Yeah.
program in the San Bernardino Mountains, their aftercare program involved calling former patients, finding out if they relapsed, and then bringing them back into care if they had.
Yeah.
And if it's not working, then I think treatment programs could be doing a better job of figuring out what will work. What does this patient need that they're
Yeah.
not getting in our program?
I totally agree with that. And I think that is actually where I started to get some information around people becoming alarmed with the treatment facilities and well, the treatment model in our country. And again, I don't have all the answers. I mean, I have the pipe dream answers. I'm great at the strategic planning and the vision, but as far as like actually how that would practically work out in our country, that's above my pay grade or ability, but I'm sure we could definitely be doing a better job because one of the things that has come up lately is that it's a revolving door. The statistics that I heard maybe 10 years ago even were that it takes opiate addicts 7 to 10 times to try. And that's a lot. I mean,
Yeah.
these facilities are 30,000 plus a month, maybe.
Yes.
So like that's
Yes.
a lot of money flowing through this. And I'm for it. I'm for treatment. I'm for advocating for what people need, but there's definitely a missing link. And I totally agree with you that it's the aftercare piece. I'm a part of the mental health and addictions like task force here in my little local community. I live in Maryland, and we meet
Yeah.
every other month and we talk about um, gaps, and there's all kinds of people in the room, stakeholders
Yeah.
of all kinds, government, private people, police, lawyer, all kinds of people. And we've been brainstorming. I think I've been a part of it for several years now, and it's been very interesting, but that's literally the thing I write on the paper all the time. Long-term treatment. Long-term
Wow.
treatment. We need
Yes.
long-term treatment because you cannot expect people anybody, whether it's opiate addicts, alcohol, drug is a drug, to leave after 28 days. And even if you tell them all the things and you connect them with, even if they had a stacked recovery capital bank,
Right.
they're not all going to do well.
Absolutely.
They're not going to
It's
do it.
true.
The recidivism rate in addiction has just always been high. It's always been
Yes.
high.
Yes.
So the lack
Absolutely.
of support for aftercare is a huge gap. And again, I don't have all the answers for that, but I wish we could spend more time on just figuring that out. And also things like, in my community, we have no public transportation here. We have a
Yeah.
very big housing problem. We don't even have a shelter right in my county.
Totally.
I mean, so
Yeah.
like there's just a lot of barriers and it sucks, that's just the only way to say it. It just really sucks for the
Yeah.
people who have to deal with that because there
Yes, it
just
does.
aren't the resources here. I mean, I worked in child welfare in the beginning of my career for 10 years, and like all of our kids in Harford County had to go elsewhere to Baltimore City, to Frederick, to down in the Eastern Shore because there were no group homes. And I'm not saying we need group homes everywhere, but I'm just saying we didn't have a lot of placement options for a lot of our kids. So I spent my time
Yeah.
going around the state visiting these kids because we're required to see them once a month all over the place, sometimes 3 hours
Wow.
away because, like they're just, there wasn't a placement for them. And so
Yeah.
even in the best of the circumstances, even if you had all the recovery capital in the world, there's just some barriers in some
Yes.
communities, that are just going to be a thing. So I think what we can do to reduce that in whatever way, personally or professionally, just educating people like your podcast and just bringing this to light, and again, I'm not here to say like rehabs are bad. I mentioned that in the beginning. Like I don't, I think rehab is great in a lot of ways, the right ones for removing you from your environment, for making you focus on yourself, for getting some very
Yes.
intense therapy and education on what addiction is, what it isn't, bringing in the family for a family program. There's a lot of value in 28-day programs. I'm a believer. But
Yeah.
I also think that the revolving door model, even the medical maintenance model, these things are harmful to people. Like they were designed for being short-term fixes to help people in the beginning in the crisis, and they've become long-term pipelines for
Yes.
our drug companies to make billions of dollars off of some of our most vulnerable people. And it's really sad. It makes my heart hurt. day when I think about that. That's why I
Yeah.
can't get behind some of that. And I understand some people are really saved by it, but it's not being used properly. And I don't think
Hmm.
most Americans understand that. They don't
Yeah.
understand who's really benefiting from that. Who's really
Yeah.
benefiting from keeping your person on Suboxone for life. There's no plan. I said to one of my clients one time, "Hey, when you go like and they talk to you about like what's next or how to get you out," and they're like, "Oh, yeah, no. They never talk about that." And I'm like,
Hmm.
"What?" What? Like this isn't supposed to be a forever drug. It's just supposed to be a let's help you get
Well,
through the crisis drug. That's how it was originally
yeah.
designed.
Yeah.
And it's taken on a
Well,
different
I
form.
I know there are some people who benefit from short-term placement on Suboxone, but there are a
Absolutely.
lot of people who benefit from long-term maintenance on Suboxone, and Chris Kuhn is one of them. I mean, he is doing incredibly well today, and he remains on Suboxone, and he knows he needs it. I mean, I think what it comes down to is what does the individual person need in order to
Yeah.
sustain their long-term recovery? Some people might need that medication and other people don't.
Well, I think what we all need is a layered approach. We need layered approach. We need some really good recovery work. We might need 12 step. We might need books. We might need spiritual programs. We might need rehab. We might need community. We might need therapy. We need all like complementary. We might need some acupuncture. Maybe you need some supplements, nutrition education. Like we need a layered approach to healing, whether it's a mental health problem only or if it's a dual diagnosis with mental health and substance abuse, which we know substance abuse is a mental health problem. We don't need to separate the two. And what we need most in all of that is compassion. We need compassion where we look people in the eye, we use their names, we call them by their name, we say we love you. Unfortunately, you can't like scream at me or kick or bite or hit me. Yes, of course, those behaviors aren't appropriate, but we still are going to work with you and love you through this, and we're going to have boundaries and help you. But there's definitely some places in society where that's just lacking. So. Your work
Yeah.
is so powerful and important. I'm so thankful that we got
Thank
connected.
you.
I feel like I want to have another episode with you because there's just like so much more. Um,
There's a lot to talk about. It's true. We barely scratched the surface.
Gosh, so let's maybe we should schedule that and do another one, like a follow up, just like a part two. Like, hey, this is what else you found, and
Yeah.
and maybe even some follow ups from your work. Like I'm sure you are following up too, like on just what's being done, what's still the gaps, or where is the good work being done? Who's doing the good work? I like to highlight
Yeah.
that too. So,
Yeah,
um, where,
absolutely.
where can people find you if they want to reach out?
Um, Google Rehab and American Scandal. It's available on Amazon and wherever you buy your books. I also have a website, shoshanawalter.com,
Okay.
where you can find me, my contact information, and all my social media
Hmm.
links. But yeah, Rehab and American Scandal. My name is a tricky one to spell, so.
I will link all that in the show notes below. So
Okay,
thank you
good.
again so much. And I really loved our time together. So
Oh,
I hope you have a fantastic day and I look forward to
thank
our paths
you.
crossing again for
Yeah,
part two.
absolutely. Nice to meet you. Thanks for having me.
You're welcome.